Hello, my name is Jordan Davis. I'll be taking you through the presentation on the healthcare reform and human resource management preparation. We're going to be looking at the Patient Protection and Affordable Care Act, commonly known as Obamacare. I invite you to follow along as I will be moving quickly to fit this in 5 minutes. The first slide, the introduction. What is the Patient Protection and Affordable Care Act? That's what we're talking about. It's the biggest change in healthcare since Social Security in 1965. It's a challenge for both employees and our employers and individuals. This presentation will focus specifically on the implications for employers. What are the two main challenges for employers? Well, I think there's two, financial and in terms of compliance. The financial end of it is that businesses are required under the Act to provide health care for their employees. The compliance end of it is that it's a new system. It's a fairly draconian system with a lot of new regulation which will need to be learned and adhered to, or penalties will be assessed. Specific challenges for human resource managers include learning the new system and explanation of the new processes to business owners, executives, as well as employees. Let's look at the next slide. What is the Patient Protection and Affordable Care Act? What does the Affordable Care Act attempt to do? I think three main things. Comprehensive coverage for all Americans. It states that it's the goal of the Act to provide coverage for 100% of Americans. The Congressional Budget Office estimates that 94% of Americans will be covered under the Act. The Act shifts focus to primary care through provision of a 10% subsidy to doctors if they choose to go into primary medicine as opposed to specializing. And it attempts to simplify and streamline healthcare. So how does it do those things? Well, first, through the individual and group mandate, this is how it's going to provide coverage for all Americans. The Act requires Americans to have coverage by 2014 or pay a tax. Creation of one big pool. They're going to lessen the costs by having everyone buy into one large pool, which will bring the cost of premiums down as well as copays. And lessen the burden on the individual. There are three other main, I think, significant things that you'll see on the presentation here is mandates limits on coverage costs, pre-existing conditions, and minimum coverage. So you can only spend so much of your salary on healthcare under the bill, and you cannot be turned down for pre-existing conditions. And they define federally what minimum coverage entails is much broader than it is now. Let's look at the next slide, the impact on the small group market. So first, mandated benefits. It's mandated that small businesses or any business, if you're an employer, you provide health care for your employees under the new bill. For the small group, there are three ways to do this. Number one, buy insurance from private companies. That's the most expensive option. Number two, purchase coverage through the SHOP exchange, which the bill sets up, which is basically an arena of simplified healthcare options for small businesses exclusively to purchase subsidized healthcare through at a lower rate. Or third, compensate employees to purchase their own insurance. That's after tax. So you're basically paying the employees the amount of their insurance costs after tax. The other impacts are removal of waiting periods. There is currently a 90-day, or under the Act, there is a 90-day limit to be covered after beginning a new job. Actually, they say as soon as the paperwork's filled out, you should be entered in to receive benefits when starting a new job. Now, there are some differences here to note in the beginning. Delineation between the small group and large groups. The 90-day limit does apply to both. However, the Act specifies between small groups, which are 50 full-time employees or less, and large groups, which are 50 full-time employees or more. And there's some differences there which we'll talk about. How do they do this? How do they force businesses to do this? Is through taxing. If every day that you do not provide coverage, you will be taxed. However, when you do offer coverage, the government is going to provide a 50% subsidy for employer premiums for the first 2 years, so that will help defray the costs in the transition. I thought this quote was fairly interesting here. It says, "For years, businesses will have to devote considerable resources to monitoring and navigating regulatory changes. Few small businesses have human resources, legal, or accounting departments to track and plan changes." So this presents a very difficult challenge, particularly for small businesses who probably don't have individual human resource departments to track and monitor what changes are necessary. So small businesses may be looking at more work, as well as possibly increased fines for lack of compliance. So it's very difficult. These are just a few highlights of some of the broader changes. There's many, many more that affect the bill, which we don't have, or affect the businesses, which we don't have time to get into. If you look at the next slide in the large group, well, first off, of course, there's the mandated insurance that employers are required to provide. However, there are no subsidies for the large group market. They will be on their own. Most large companies do provide health benefits if they have 50 to 100 more employees. There is a piece of evidence which says for those companies with over 200 employees, roughly 95% of them provide health care already. So that said, employee costs cannot exceed 10% of their income. So it is going to be an interesting challenge, as now hopefully no employees are paying outrageously more than 10%, but some companies will need to adjust their policies because of this. So the large group impact, we're going to see minimal change because of this bill, as most of the larger markets are already providing coverage for their employees. It is actually estimated that there could be a 3% decrease in costs for the larger market, because there will be more people buying into the insurance field. So a piece of evidence here says in the large group market, the change would range from no change to a decrease in 3%. So that's kind of the range we're looking at, not a huge impact or possibly a positive impact. If you go to the next slide, what is the application for human resource managers? A couple hurdles. We see that there's new policies, which means new rules, new expectations, new compliance is needed. So that's always a challenge in learning new objectives. The compliance end of it is there is significant tax penalties for not complying, which could be challenging. And also explaining the new benefit options to executives, business owners, and employees can be difficult when the information is difficult to attain. Examples of one of the new compliance options that I wanted to give you a taste of, one of the specifics in the plan, is that individuals from 133% to 150% of poverty, that's the national poverty level, will be eligible for subsidies that will allow them to purchase coverage while spending no more than 4% of their income on premiums. And individuals with incomes from 300 to 399% of poverty will spend no more than 9.5% of their income on premiums. So that's just a small taste of what's to come in making decisions and determining what's best for each individual business and employees. This has been brief. We'll look at the next slide, which is the conclusion, and that is that the Patient Protection and Affordable Care Act is extensive, requires a lot of study. This is barely skimming the surface, and companies and especially HRMs need to dive into this and learn new requirements. The Affordable Care Act actually changes the healthcare landscape. Whether you are in favor of it or not, it definitely has a huge impact and changes how benefits are delivered. That change is never easy, so expect a rough road ahead. Competent HR managers are necessary for success. This is where HR really needs to step up, learn the new system, determine timelines and what's best, and be able to explain that in detail to their owners, executives, and employees. Thank you very much for watching. I hope this was informative, and we'll see you.